Comedian and actor Cedric The Entertainer is one of a kind when it comes to entertaining us in movies and TV. Now he's turning his attention to a more personal matter, diabetic nerve pain, which is a serious complication of diabetes. His father has type 2 diabetes and suffers from burning, shooting pain in his feet and hands. And Cedric joins us this morning to talk about a new program called Step On Up. And he's also joined by Dr. Ann Peters. Good morning to you both.
Good morning. How are you doing?
Doing great, doing great. How are you guys?
Good. Excited.
Good.
We're out here in LA. Just happy to be up.
Must be nice. It's cold here in Dallas. But hey, listen, we're talking about a serious subject this morning. Cedric, why don't you tell us a little bit about your dad?
Well, my dad has type 2 diabetes, as stated earlier, and he is, in the last few years, we've noticed that he's, being affected by a little burning, shooting pain that happens in the hands and the feet. This is known as diabetic nerve pain, usually a symptom of diabetes, and so we've been able to get on top of it and get him some pain relief, and so I wanted to be able to encourage others to do so. So I partnered with the American Diabetes Association and Pfizer to introduce this program, Step On Up. We've got the website steponup.com where people can learn more about diabetes and diabetic nerve pain.
Now, Cedric, help me out here because, my family, I have a problem with getting them to go to the doctor. They're old school, they're Southern, they only go to the doctor when they're literally on death's bed. What do we do to get our family members, especially African Americans who are affected by this so much more than everybody else? How do we get them to the doctor?
Well, that's really why I wanted to get involved, use my celebrity and my voice to say this. So what's your people's name? I'm going to tell them right now. Go to the doctor. Get your diabetes checked out. Said is saying this, but we have to be involved. We can't step back. A lot of times people, they have symptoms and they don't want anybody to know. They think that they're bothering you. They don't want you to go to the doctor. They got it. They can self-diagnose, saying, "Oh, the pain is just, that's just my hands are tired, or I've been standing on my feet all day. That's all it is." We wanted to let you know it's important to talk to your healthcare provider about these things and get the right answer. Go to the website. Fill out the diabetic nerve pain assessment. If you have some of the signs, some of the symptoms, take that to your next doctor's visit. This way you can do it in the privacy of your own home, taking the assessment, and you don't have to really include a lot of people in your business, but it's important for all of us to encourage folks to really take care of their health.
Absolutely. And doctor, tell me about some of the symptoms and maybe some of the treatments if they are having some of these pain issues.
Well, the symptoms of diabetic nerve damage are burning, electric, maybe numbness, kind of tingly feeling that happens in the feet and in the hands, and it's often worse at night. And it's a sign that there's been damage to the nerves from high blood sugar levels, although a lot of people have high blood sugar levels and don't even have any symptoms. So it's important if people are African American, Latino, and anybody with a family history of diabetes is at risk. And there are all sorts of treatments now. There are treatments for the nerve pain, and there's more treatments than ever for diabetes. So it doesn't have to be a horrible disease, but if you don't face it and you don't go to the doctor if you have symptoms, or even if you just want to find out if you're at risk, it's something that avoided can be incredibly problematic, but faced can really be dealt with. So I really encourage people to seek medical care, to talk to their healthcare provider, and also to go to the website, www.steponup.com, where they can actually fill out a self-assessment about signs and symptoms of diabetic nerve damage.
And like you mentioned, if it's untreated, there can be some very serious complications, right?
It's horrible untreated, and there's all sorts of other related complications like high blood pressure, stroke, heart attack. It's all related to diabetes, and it's all preventable. That's my message. Prevent this. You can deal with it, but you can't deal with it if you don't talk about it. So get out there and talk about it.
Absolutely. And Cedric, we certainly appreciate you lending your name to something so important. What do you have going on? What's coming up late? Are you going to be in Dallas anytime soon? Can you come in studio and see us?
Well, I do. I am performing in Dallas on December 20th. I'll be at the Verizon. Not sure exactly when do I come in that day. If I get an opportunity to come in the studio, I will. Also encourage people to go see the movie Top 5. This is written and directed by Chris Rock. I'm starring in it as well. Funny movie will be out in early December, December 5th. Want people to flock to the theaters and go see Top 5.
Sounds good. Well, thank you guys both for joining us this morning. We appreciate all this great information. Y'all have a good day.
All right. Thank you so much. I appreciate it, Dawn.
All right. Take care. And you can check out steponup.com for more details.